Thank you for joining the session today on influenza or the flu. What is influenza, also known as the flu? The flu is a contagious respiratory illness, and it is caused by the influenza viruses. It can cause mild to severe illness and at times can lead to death. It can be prevented by getting the flu vaccination each year. Key facts about the flu. Every year in the United States, on average, 5 to 20% of the population are infected with the flu. More than 200,000 people are hospitalized from the flu complications. About 36,000 people die from the flu. Symptoms of the flu. Symptoms are going to include usually high fever, headache, extreme tiredness, dry cough, sore throat, runny or stuffy nose, muscle aches, and stomach symptoms such as nausea or diarrhea. Complications of the flu include pneumonia, dehydration, or worsening of a medical condition such as asthma, diabetes, or congestive heart failure. How does the flu spread? Respiratory droplets caused by coughing and sneezing, touching your mouth and nose after touching something with flu viruses on it, and most healthy adults may be able to infect others beginning 1 day before symptoms develop and up to 5 days after being sick. How to prevent the spread of the flu? You need to get vaccinated and use respiratory hygiene and coughing etiquette. You will cover your nose and mouth with a tissue when coughing and sneezing. If you do not have tissues available, sneeze into your sleeve, not into your hands. Use tissues to contain respiratory secretions and dispose of the tissue after each use. Perform hand hygiene after contact with respiratory secretions. Sit at least 3 feet away from others if you are coughing or sneezing. The flu shot contains an inactivated virus. 2 weeks after the vaccination, antibodies develop that protect against influenza virus infection. October and November are the best times to get vaccinated, typically each year. The flu season can begin as early as October and typically last as late as May. Who should get vaccinated? People at high risk for complications, such as individuals 65 and older, children, and those who are immunosuppressed or have chronic medical conditions. People 50 to 64 years of age should get vaccinated as well, as nearly 1/3 of the people in this age category have a medical condition that places them at high risk for serious flu complications. People who can transmit the flu to others at high risk for complications include healthcare workers, caregivers of children 6 to 23 months old, or people that are in close contact with people that are 65 years and older. Priority groups that the CDC recommends for getting the flu vaccine include those over 65 years old, children ages 6 to 23 months, all people ages 2 years to 64 that have chronic health conditions, pregnant women, healthcare personnel who provide direct patient care, and people in household contact and out-of-the-home caregivers of children less than 6 months of age. People who should not be vaccinated include those with severe allergy to chicken eggs, those who have had a severe reaction to a flu vaccine in the past, those who have developed Guillain-Barré syndrome within 6 weeks of getting a flu vaccine previously, children less than 6 months of age, and those who have a moderate or severe illness with a fever. They may return for the vaccine when symptoms lessen. Possible side effects of the vaccination include mild symptoms such as soreness, redness, or swelling at the site where the shot was given, low-grade fever, and body aches. Some severe reactions, such as breathing problems, could occur a few minutes to a few hours after the shot, usually among people with severe allergy to eggs. The influenza vaccine is grown in hens' eggs. This concludes the training on influenza.